is now starting. All attendees are in listen-only mode.
Thank you for joining our webinar, How to Effectively Manage COVID-19 Risk in the Workplace. Today's webinar is hosted by Jill Tonachio, Vice President for Commercial Development for Eurofins SAFER Work, and Ann Shimshaw, Business Development Director for Eurofins SAFER Work. I'm Genevieve Randall, and I'll be moderating the webinar. Before we begin, I have a few notes about today's webinar. The broadcast is being recorded, and you'll receive this recording and a copy of the slides via email within 3 business days. We'll follow the presentations with a live Q&A session, during which you can submit your questions to our speakers. To submit your questions, use the GoToWebinar sidebar menu. Select the Questions tab, type in your question, and hit Enter on your keyboard. You can submit your questions throughout the webinar. We'll follow up with any questions we don't get to during the Q&A session.
Good morning, everyone. My name is Ann. I'm Ann Shimshaw. I'm the Business Development Director here at Eurofins for the SAFER Work program. I have had the excellent opportunity to work with many UNPA members in the past, doing a bunch of in-person seminars when we were allowed to do these things in both our Colorado location, some remote Utah locations. So Eurofins has had a great relationship since 2017. We are also members where we're working with them, where we're working with the members to do testing, auditing, all those kind of things. So working with UNPA has been just wonderful for us. Okay, so we kind of are skipping some slides today. I'm sorry. Everything is a little glitchy on my end. The agenda for today is going to be the COVID-19 testing options, the planning strategy for a COVID-19 program. We're going to do a product demonstration of our at-home self-collection kit, and then we're going to let you do some questions and answers. Here's what Jill and I look like. Obviously, you can see us right now, but just so if you see us at an event, you remember us and you welcome us and you say hello. Why Eurofins? We've had a great relationship with UNPA. We're a world leader in a lot of testing, auditing, in natural products, pharmaceuticals, food, you name it. Our SAFER at Work program was designed once we started seeing all of the hot buttons going off last December and January. And we want to help you limit the impact of COVID-19 in your workplace. The programs that we have are comprehensive, so we can help you as little or as much as is needed within your own organization. So one of the things that you'll see is this great quote from Jill Martin. Jill is our CEO and one of the founders of Eurofins. He definitely is an amazing speaker. He's a great influence amongst our company. And he talks a lot about really understanding where our place is in a cooperative partnership with our clients. So I love this quote. He said, as the world faces the challenges of COVID-19, at Eurofins, we are ever mindful of our vision and the race to bring all of our resources to bear on the saving of lives during this crisis. This is all about the partnership that we want to have with all of you out there and how we can help as we always try to help. So next, we're just going to kind of go into the program overview, and I'm going to turn it all over to Jill.
Sorry,
Okay,
Jill.
great.
Looks like you were muted for what?
Thank you, Anne. Thank you very much to UNPA for co-sponsoring this webinar with us today. Our Safer at Work program entails a suite of services in response to the COVID-19 pandemic. A lot of the tests that we're doing in the platforms is nothing new to our company and the different businesses that we have under our Eurofins umbrella, just with a different endpoint of discovering the SARS-CoV-2 virus and where that might be showing up with your employees and your workplaces. So since we've launched our Safer at Work initiative, which was early in the pandemic, I guess we're still in 2020, so April of this year, we have several different tests, and you can see those images along this timeline here in the burnt orange color. We have PCR and antigen and antibody testing for your staff and your employees, your friends and family. For facilities, we do air quality testing. We test surfaces for the presence of SARS-CoV-2. We can do site wastewater management and testing at your facilities. We also test products. So if you're providing PPE and using that for your employees, we test those. And we also have a pretty extensive consulting, education, training services that we can also support your endeavor of how you're managing the pandemic. Let me give this a moment to reply. There we go. So this is a process flow because it can be confusing, especially with all of our orange circles along the timeline. We have a lot of different tests, a lot of different ways you can go about doing a surveillance program or active testing for the presence of the virus. But it really is unique to each individual's organization with what's happening in your community and how you are doing your social distancing or any kind of mitigation strategies. So what that looks like, you'll see the 3 bars across the bottom of the screen that are just some foundational criteria and aspects you would need to consider as you're developing your program. You know, what's happening with the symptoms of your workforce, and what are the local infection rates and what's happening in your community, and maybe any ongoing efforts that you're doing or that your employees and your staff are doing just in their personal lives, and you know the risk factors that they're exposed to. So if you look at the long vertical rectangle with some boxes in it on the left-hand side of your screen, our Sentinel testing offers you some options of what might work in terms of getting some early warning signals of anything that might be happening. So I'll go into each one of these services in more detail, but just to give you some context, our surveillance program, you might want to think about wastewater testing, surface testing, any kind of baseline PCR or pooling, testing your worn masks for your staff, perhaps daily, weekly, by the shifts. And when you get those results, that will feed into kind of what comes next. So once you get those results, you might decide if you get a positive that you'll test individuals or do further pooling testing, or perhaps doing some rapid testing with the antigen on site. If you get negative results from some of these Sentinel testings, you might go right back to those same practices and decide the recurrence at how often you would like to do some of that testing. So when you get those tests, you can decide then with some objective information what comes next, whether the tests come back positive or negative, and then perhaps going to the next step of testing individuals, which will pinpoint your problems, versus the Sentinel and their surveillance testings, which typically look at the bigger picture and help you do a surveillance program on your total population and your total facility. So I think where it's really best to start when people don't know, some industries like the entertainment industry or certain unions are mandating the testing frequency. But typically most companies are in a situation where they need to decide what should we do and what's going to work best. So often the CDC guidelines and what's happening in your communities, or perhaps what your governor is suggesting, helps to get you started. And usually some of the key indicators are when people have symptoms, or that they have a known exposure, or you can't really work with 6 feet of distance between your employees, or perhaps it's just employee fear and their uncertainty if they're traveling over the holidays, or they know that, like myself, have kids home from college. You know, what does that look like to ensure safety and confidence in your workplace? So the types of tests that we have for your employees, the gold standard is that PCR testing, which will help you uncover that actual detection of the presence of the virus in your employee. The antigen tests the protein. That's what the rapid test. You're seeing a lot of that recently, like at airports and for day of testing, that helps you give you that immediate result. And then there is the antibody response that can help come into play when you're thinking about who may need to be vaccinated when that becomes available. And there's either the IgM or the IgG, which may tell you of a recent infection or a past infection and where someone is along the curve of building antibodies. So for the PCR testing, this is really the best test. Does someone have an active presence of the virus? They may be symptomatic, and we can do this with the nasal pharyngeal swabs that really go far up into the cavity, or we also do nasal, like mid-nasal, which we will demonstrate later on in this presentation as an easy, pain-free way to do the self-collection kit. Sometimes it requires the oversight of a medical professional, and we are doing mostly nasal swabs, but we're in development for saliva and saliva pooling, which is just days away from being formally released in Eurofins. I talked about the Sentinel program, and I'll give you a little bit more detail of each one of these services. The environmental surface swabs, it's probably similar to any of you manufacturing companies, supplements company that may be doing that already, testing for listeria in your drains, salmonella if you have any protein or food processing in your facilities. So the environmental swabs is just for high touch areas. You can use it in your manufacturing space, or perhaps in your break rooms, restrooms, vending areas, or on your production lines that may be high touch. Again, an early warning if anything is on your surfacing areas, which may be great for you to go back then and test PCR employee testing. Another way that may be helpful for your staff or for getting a group of employees tested is the worn mask. It's similar to what we're doing with the surface testing, but it's just as it sounds. You see the image there of a group of people wearing their masks. And once they're done with the end of their shift, you can pack them up in groups, in zones, in shifts, and send them off to Eurofins, like just as easy as it looks here in this FedEx package. And similar to how we are testing the surfaces, we would test the surfaces of those worn masks and get you results back in 24 hours if we find the presence of that RNA on the masks. The wastewater testing, you've likely seen this on the news, a lot of university settings, nursing home settings where there's kind of a closed loop of individuals that may be using the restroom facilities, and that site where you have kind of a closed population, you could test the wastewater to see if there's presence of the virus in that wastewater. And then after that, depending on what has been found, the levels of the virus, then go back and perhaps test the employees. Same concept with air quality. We have the little receptacles, the cards that you can place about, you know, based on where your airflow is. This is also a PCR test where you can see as the air passes through these little filters, and you send those cassettes off to Eurofins to be tested of your general overall air quality. So I think now, Genevieve, it's time for a polling question that you can get some feedback from the audience.
Thank you, Jill. Okay, that question should be launched on everyone's screens now. Our question is, do you currently have a program or plan in place for COVID-19 control? Select your answer on your screen now. I'm going to leave the poll open for about 30 seconds, then I'll close it and share the anonymous results. All right, I'm going to go ahead and close the poll now. Okay, and it looks like the majority of our audience today does have a plan in place, which is great to hear. Okay, Jill, you can take it away. Thank you.
Sure, thank you. So next we'll think about what does that look like if you don't have a plan in place. And as we've all been experiencing, sometimes the CDC guidelines change. The presence of the virus has been going up and down on the curve. So I think, you know, we're not quite through the woods yet, and until the vaccine is widely used, testing in some shape or form and some sort of mitigation plan is likely part of our current situation, or certainly the near future. So I think when we're thinking about this, we're looking at what does that look like to pull something together? And it starts with kind of level setting of what your current situation is. What's going on in your community? Has anyone on your staff been exposed? Do you have any known positives in your population? And really setting a goal of what you want to accomplish with that testing. Do you need to decide on a quarantine plan or adjust your workforce? If you have known positives, what would happen if you got a positive? Thinking about those what ifs so you can incorporate that into what type of testing do you want to do? How frequently do you want to do the testing? And decide whether it's individual or pooling. And then think about what that means of what you would put into practice, of sending people home in quarantine, and thinking about the contact tracing. If someone shows up positive, who might be in their close working environment that may also need to have some sort of plan in place. So when you think about the testing for our workflow, especially now that we have the self-collection kits, and you can do it on an individual basis, and you don't really need to say, we're going to test everybody the Monday after Thanksgiving. You can really handle this in unique situations, that if you have an individual that you would like to test and you would like to use our self-collection kits, this is the workflow. There's a registration link. Your organization will get an access code, and someone gets a kit delivered to them. So the employees will register their kit online, and they would complete the symptom tracker. We have a remote physician that can provide oversight for that guidance that's needed, and then the specimens are collected. Our lab gets them, reviews the results by the healthcare provider. If you have any positives, we'll give you a call, and the employer has access to these results as well as the employee. So we've deployed many different types of testing protocols across different types of businesses. And these photos show you different ways that we've done it. We've done mass collections, individual test sites, individual tests with the self-collection. So I really just wanted to highlight here some of the customizable solutions that we've had. And you'll likely know some of these bigger names where we've done this, and certainly we've helped plenty of small businesses as well, in addition to these images you see here. So if you start over in the top left-hand corner, we have a large partnership with the LPGA. So we helped get the tour back on TV, getting the golfers back golfing. So this is just an image that shows you what the registration looks like. We've done Formula One racing all over Europe. So the next two pictures, you can see the car and the signage directing the racers, the admin, the staff to where we're doing testing at all of these different events over time. You know, it's not just a one and done. We're routinely testing for both of these events. To the right, it's a large picture. It's at the Paris airport where we've done testing for travelers, just regular travelers coming in, and what the registration and the lineup looks like. The second picture is also from the Paris airport where you would come in, you go through your registration, you get testing, and then the one on the right is our staff at the Brussels airport. And there's a second image here at the Brussels airport, these two images, which is a mobile trailer that we set up because the Brussels airport, we're handling, I think, all of their testing. We're the exclusive provider. You know, there is some other testing that travelers are doing, but I think when you think about that and where Eurofins can support you, if you don't need a mobile lab on site or a big collection events, you know, you really want to vet out your testing partner of, you know, what's going to work best for you. What do you need? Who has the experience, the expertise? We have a guarantee for our 24-hour turnaround time. And as I mentioned, we have several flexible options, not only with the different types of tests that we do, but the types of testing programs of what that looks like for customizing it for you. If you need staff or medical professionals that can assist with that, we can do that for you, as well as information, whether you need dashboards and downloads of the results to help you with those interfaces if needed, or just delivering paper or encrypted files to you. And depending on what your budget is, we can really customize a solution for you based on, you know, what your endpoint is and what your constraints look like. And on that, if you're not certain what you need or how to go about it and who can help you, we do have a consulting team. As I mentioned, they can help you design the protocols, testing frequency, pull in data, case studies of what we've done in the past to help you figure out what that looks like. And if you go through our auditing and consulting services, we can provide for you this seal. You see an image of it there, that round seal, where we can give you documentation and backup to show that you've done the extensive work to reduce your risk. And they will come on site, our auditors will come on site to do the audit, give you an audit report, devise for you a remediation plan that you can enact on a timeline to show that you've made a change. So that SAFER at Work technical review, once that is complete, you can get this verified seal. We even have stickers that you can put in your window or around your work site to show those extra steps that you've done to ensure the safety of your team, and therefore passing on that assurance to your end user and your customers. So I'm going to show what our self-collection options are, and then I'm going to grab my college-age daughter who is going to demo the kit. She's over 18, so we decided to order a kit for her, and I'm going to walk through these steps of what this looks like. So if you wanted to do the self-collection, you would set up an account with us. You would order and receive the kits with your unique access code. You would collect the sample or have your individuals collect the sample, send it off to the lab, and get the results. Those are the couple different ways that we can do this. You can do a bulk order and have several people swab on the same day, or you can set it up what's as a grab and go, where say you would have 100 kits on site, and then if anyone showed symptoms or needed the kits, they would grab and go. They could take the kit home with them and send it off, or you could just have them do individual orders with your unique access code. So you can see either it goes through this top workflow that would be through your facility at your manufacturing site, either through a mass collection event or the grab and go, or the employee, here's like the little neighborhood where they're ordering it to their houses. Either way, the sample ends back in our lab to be tested to get you the results. The employer could be invoiced and have access to the results and pay for the employee or the individual path. Either way, the employer gets the results and the individual gets the results. So next, I'm going to get my lovely assistant to come on board to show you what it looks like. Just one moment. Okay, lovely assistant. Did you just wash your hands? Okay, or you can do your hand sanitizer. Okay, so I'm going to do my hand sanitizer. But I did wash my hands right before this webinar and Clorox wiped down my laptop. So you can see here, we're going to show you the instructions. Here's my daughter, Alicia, over the age of 18. So she's eligible to use the collection kit. And she has just come back, as many students are, from Tennessee. We live in Pennsylvania. So I don't know that she's been social distancing all times of the day. So this is just, we figured we'd do a live demo of you to see what the kit looks like. So what arrived after we went and registered for the kit and order it, it's a shipping envelope, just about this big, you can see, that will contain everything you need for the kit. So this is what the kit looks like, that has all of the supplies that you need inside, and we're going to walk you through how easy the process is. So inside of the kit, when you open it, right on top is the step-by-step instructions that will walk you through what is needed. And we will follow these steps along so Alicia can show you how easy it is. Just as I open the kit, the FedEx shipper is in there. I'm just going to set that off to the side so we complete Alicia's draw. So she's already washed her hands, and we've opened the kit, and the contents are all on the table next to us. So Alicia is going to take the swab out, and you are going to open it up and peel it. Just hold it up where people can see it. So she's going to take the cotton swab. She's just going to get ready to take it out without touching the tip. And just so you know, this label will come pre-printed with the testee's name on it. And we just wrote her birth date and today's date for the collection kit. And now, so we have this label ready to go for the shipper tube once she's done with her swabbing. So Alicia, if you would like to start with one of your nostrils, and you will just swab it around in the circle for 3 times. And just so the tip is in your nostril, this is just a mid-nasal, and she's just sensing that it's touching, but it's not killing her, if any of you have had the nasal pharyngeal swab. So this is the shipper tube. I'm going to be her lovely assistant now. This will be discarded, and I'm placing this label onto the tube that is barcoded where we wrote her birthday. So you just unscrew the cap, and it goes with the cotton swab side down, into the medium. Screw it back on. You're making sure the lid is secure. Biohazard bag with the absorbent strip is in there. And Alicia, if you would drop the swab into it. And we just zip it up. And it's going, there is an extra swab in case you drop it or something goes haywire, but great job, not necessary. So it goes back into the kit, and then it will go back into this FedEx label. But at this moment, we are going to register our kit. So your directions, and this is a very important step, we've already gone and ordered it. If you do it through your access code, you will have an identifier for Alicia or whoever your patient is. And before you ship it back, you register your kit and let the lab know it's on the way. So after this call, we are going to do that, and we are going to ship Alicia's kit out today before the 5 o'clock or 6 o'clock, whatever the FedEx deadline is, so it arrives at the lab tomorrow.
Thank you.
Thank you. Thank you, Alicia. Pretty easy. And because it was my daughter, we like opened the kit just to look at the box, but I said, let's really try to go through it to make sure. So that's the first one. I ordered one for myself, but I haven't done it yet. So if you take a look at it, and there was an image here, it's like everything has a number, a description, and a photo that shows you very easily how to handle it. So we do have an age restriction of 18 or older. That's what our emergency use authorization was approved for. But you can do some of our other collection methods for people under the age of 18 if you have that in your workplace. So thank you for your partnership. We've done several other events with United Natural Products Alliance, but by attending this webinar, or for any of your colleagues who are members of UNPA, we will give you 10% off the list price for our kits, not our self-collection kits, but if you do a collection event, we have already chosen to be in the marketplace as one of the lowest providers. I think we might be the lowest. I don't know if anyone, we've had a pretty high demand, so you don't know with supply and demand if the pricing will change. But if you were just to go outside of UNPA and outside of our business-to-business relationship and order the kit on your own tomorrow, it's $99. We do have some pricing that we do for employers, so we could get into that on another call. But if you yourself would like to order it, you'll get a 10% discount through the UNPA. So you see two names listed there, Ann and Connie. They are our manufacturing reps and have helped us coordinate this webinar. So if you're an individual business and you'd like to talk further, Genevieve is going to provide some information at the end of this webinar for anyone to reach out. I think we have a polling question, then we're going to open it up to Q&A. So we'll move to that next, Genevieve.
All right, thank you, Jill. So our polling question, do you want a Eurofins representative to reach out to you regarding services discussed in this webinar? The question should be on your screen now. If you have questions about either consulting or about those self-collection swabs or anything else you heard about today, select yes on your screen now and we'll reach out to you shortly. I'm going to leave this open for about 30 seconds and then we'll move into our Q&A session with Ann and Jill. Okay, so we're going to move into Q&A now. If you are unable to answer the polling question for whatever reason, but you still would like to respond, you can just enter your response into the questions tab of your GoToWebinar sidebar menu. Okay, and to submit your questions, select the questions tab on the GoToWebinar sidebar menu, type in your question, then hit enter on your keyboard to submit your question to our speakers. Okay, and our first question today is, can any of these tests identify asymptomatic positive cases? And I'll let Jill or Anne take that one.
Jill, I can
Yes.
take it. Go ahead.
Great. Nope, you go ahead.
So yes, definitely. Our sensitivity on the PCR testing is phenomenal. I'm continually impressed with the level of sensitivity on this test. So that is definitely something that is being picked up when the PCR employee tests are being conducted.
All right, thank you, Anne. Okay, our next question is, what types of things can Eurofins consultants help with when you're planning a program?
I can take that one. Our assurance group can help assess workflow. We've done for years in the food industry, lean initiative, good lab practices, and just setting up efficiencies and doing audits. And as it relates to COVID, we can help educate you on different protocols for safety, just as far as workflow, in addition to setting up the testing events. And we do several different educations. We have YouTube videos online, even for things such as just hand washing, using PPE, etc. So I think it just depends on what you're looking for, whether it's education and training, or whether it's helping design and doing a full audit of where there might be trouble spots in your organization. Whether you do or don't want to use that in conjunction with some testing, we can make some recommendations and partner with you in several different ways.
Okay, thank you. Our next question is, what do you recommend on sample collection for a typical office environment? I think this would maybe be in regards to maybe what type of testing for offices. If this is your question.
Maybe this is environmental monitoring. That's usually where I get the question. We have a really great white paper. So if you type your name in the box, we can make sure you get a copy of our environmental monitoring white paper that we did specifically for COVID. It has a lot of great suggestions. Number one thing is going to be high touch point areas, and it's going to go back to the size of your facility, the number of folks that are in there every day, and really what you're comfortable with. But that's definitely something that we go into in the white paper and that we're more than happy to help you figure out.
Okay, thank you. Our next question is, what is the turnaround time on results for the self-sampling, the self-collection?
So we have 24-hour turnaround time from the time of receipt in the lab. We say 24 to 48, and most of our results have been coming out. We monitor it with the dashboard each week, each day at each lab. And for the self-collection kits, we measure the turnaround time from the time the sample is received in the lab. So for the most part, it's 24 hours. We have had some that are 48, but you can feel confident that within 48 hours, you will have your result back.
Great, thank you. And it looks like this is our last question. What sets Eurofins apart from other testing providers?
I think to start, our 30+ year history serving many different endpoints in agriculture, in biopharma, drug development, food testing, environmental testing. We really can cover the bases with our breadth of services as well as our global footprint. And with that, our mission of testing for life has shown up in many different ways. And now with this sense of urgency and uncertainty with the pandemic, our ability to respond so quickly with the vast resources that we have. There's been several pop-up new companies and somebody that was in the shipping business and now all of a sudden they're in the testing business for COVID. I think our roots are in that scientific expertise of testing, and that's our core business. So even though we have several different types of tests, they're all rooted in science and expertise that have been around for decades. So I think with that, we can offer you different paths of doing environmental, the sentinel testing, as well as the clinical side of things with the antigen, antibody, and PCR testing. And our service, I mean, we've been able to deliver our 24-hour turnaround time consistently because of our scope of our lab network and paying close attention to detail of our capacity and our volume and our security that we have with our consumables and our supplies because of the size of our company. So it's been a solid offering that we've been able to deliver on because of our history and our experience.
Thank you, Jill. Okay, so that is the end of our webinar today. I want to remind everyone that you will receive a copy of the presentation and the recording from our session today. You'll receive that via email within the next 3 business days. If you want to learn more about Eurofins SAFER WORK, you can visit our website, or you can contact Connie McGarrett or Ann Shimshaw at their email addresses on the screen. Thank you, everyone, for joining, and have a good day.
Thank you so much. Have a good day, everyone. Bye-bye.